Oh, sure.
Okay.
Hi, everybody. It looks like a little bit of weird that you don't see the people that you are directed to, but I will do a very short introduction for the situation from the victim's perspective, and then I will leave Bledar for the perspective of the perpetrators. So just wanted to share with you that during these times, and usually in the times of public health emergencies like this of COVID-19, the issues that are coupled with gender inequality, they absolutely become more complex. And I know that in each country the context is it might be different, and each population within a context is also different, but the needs and capabilities vary as a result of different circumstances and their unique intersectional identities. We know all that COVID-19, that's not the first public health emergency in the world. Despite this, there is a marked lack of research on the implications of public health emergencies on different groups, especially when it comes for women and girls. So in the country, I'm leading the counseling line for women and girls, which is the national helpline for victims of domestic violence, gender-based violence, and sexual violence. And the helpline operates 24 hours per day, 7 days per week, through a free toll number. Just to not to take your time, but very short introduction. The helpline primary activity is absolutely to offer psychological, social, and legal counseling to victims and survivors of violence. But absolutely, despite of counseling, we have conducted a lot of research and monitoring studies that have been dedicated to the gender-based violence and sexual assault in the country. And we also have offered capacity building for training a lot of stakeholders. Lobby and advocacy and awareness is absolutely one of our pillars. That's why we had been part of the preparation of the Albanian Family Code, the law on gender equality, and also drafted the main law that we have in the country on domestic violence. Um, Now I want to go back to the experience of the victims under the lockdown. And evidence from many studies show that addressing gender equalities is absolutely a key to effectively responding to crisis and other underlying factors. And during this time, we started to see that to see which are the implications that the spread of COVID-19 had on women and girls. And as it is stated in Istanbul Convention, violence absolutely even under the pandemic time affected disproportionately women and girls, and the same thing happened. Even when you are in a health emergency. So during the lockdown, we continue to operate 24 4 to 7, and we experienced a concerning growing number of calls. By the measurements that we have done, they were 60% more than the same time last year. Many services that were targeting domestic and gender based violence victims, both public and private, were not working at their full capacity at this situation. So that's why the helpline tried to cover as much as possible. We could say that the situation is absolutely having a major impact on vulnerable women and children in many respects. Firstly, the victims of domestic violence were forced to live at home with their perpetrator, and this was the situation where the home was not the safest place for these women, so they were feeling more threatened than usual. But absolutely, we saw that social norms, such as expectations that women and girls are responsible for doing domestic chores and nursing sick family members, have also exposed women and girls to greater health risks. And outside the home environment, we know that women comprise more than 75% of the healthcare workforce in many countries. Crises exacerbate age and gender and disability inequalities and place women, girls, and other vulnerable population, such individuals from the community of LGBTI, at increased risk of gender-based violence and intimate partner violence. In fact, we have experienced that intimate partner violence has been one of the most common type of violence that women and girls have experienced, especially during the time of the quarantine. At the time when many women and girls need those services likely decreased as resources were diverted to dealing with the health crisis, or they were limited capacities of people covering the offering the services from home. We have seen that for many women who work in the hospitality industry, they work in house cleaning services, or they work on childcare. The lockdown has been a very hard time economically, as they were not getting paid for the days that they were not working. The survivors of domestic violence, those who have taken a step to leave the perpetrator and start a new life, uh, they were the ones most affected at the social economic level. We know that all the schools, kindergarten, nurseries were closed. So if the women have to work, they often have nowhere to leave their children during the daytime. And women were unable to pay back loans, which is also affecting women's longer term economic prospects. So, for those engaged in care and domestic work, they were also likely to experience grave economic consequences. One more factor, it was also the travel restriction, where public transportation was not in place, and that was also one factor of keeping women from reaching or leaving their jobs. One of the other things that we saw during this crisis, it was overcrowded shelter conditions, which also can greatly increase the spread of infectious diseases. Domestic violence shelter in some areas stopped all admissions because they were unsure how to manage the risk of infection. We were lucky because UN interfered, and in cooperation with Ministry of Health and Social Protection also developed strict protocols about shelters, so women could get proper support. Now I'm leaving the floor to Bledi to go on with the perspective of the lockdown from the perspective of a perpetrator.
Thank you, Riz. Hello, everyone who is listening to this room. Now I will explain a little bit how these services have been adopted in Albania and a general overview of lockdown situation in Albania from the perpetrator point of view. The lockdown situation increased the fear and security for the oncoming days of men in Albania. During our work and our contact with men in therapy, we understood that on this time we we examine or we find out increased fear and security for oncoming days, and this made them more frustrated and also affected their insecurity and fears, which are two emotions that leads to the violence. In most Albanian families, men are the only one who works and brings money at home. Uh, in Albania, usually it's something different from other places, and I'm talking for the major percentage that men are the only persons who are working outside and bring money home, and this immediately affected their economy, and they started also to increase this insecurity of what they will do. That is something that was known, and when we had the contact with our client from probation office or from court or self-referred cases, they was complaining in this regard because for their family it's very difficult now to live or to pay bills, and the reason that the government was a little bit slow on refunding some amount for their family, this made that perhaps their problem with their attitude or behavior, this increased the intensity of being more violent and more exploding. For many of them was something new. We identified that in Albania context, usually the man is always out. outside of home, like building or like responsibility. And in mostly of times, the wife or they the mother of children is taking care for everything in home. And for mostly of men was a little bit weird staying home and surrounding them this big fear and security because the situation and nobody knows what we'll do. And they told us that the first 2 week for them was a kind of vacation or the first week, but this not continued in the same level, and immediately started the tension between them, their wife, children, because there was not used to take responsibility home. I wanted to stop a little bit here because for some families that have been for a long time in therapy, this time was useful for them and they use all our techniques and what they have learned for themselves. How do they face the how do they cope, and they have improved the cope mechanism, how to better face with problem in family. And they told us that this situation of lockdown for a few of our client perpetrators that are in the middle or in the end of the program for perpetrator has been good because they learn more about themselves and they learn how to put healthy borders with family member and for their wife. But for most of others, this lockdown situation combined with fear and security made them more frustrated, more aggressive, and they had a kind of justification. They say that because of the situation, because this level of frustration, I am allowed to be more violent. What we noticed during this time is that the level of frustration and violence was increased, but this was found out by our services, and something different was by the police, because the police told that we don't have a high number of denouncing domestic violence. But we know that sometimes we are in the middle because not everyone is denouncing the violence, because in Albania context it's very difficult, and we have done a huge work to empower women, children, but also men to speak out and to say that we have to be against violence, because in Albania mentality is that what happened in home stays in home and we don't have to bring out of doors. But from the calls that we have, from the contact that we have, I can say that the level of violence in Albania during the lockdown situation was increased. Men towards wife, towards kids, kids towards each other, women towards kids. So there have been a lot of frustrations and a lot of anger around. Uh, what we have done, working with the Perpetrator program and at counseling line for men and boys, also we needed to adapt our services, because also we didn't predict it. We didn't know that we'd be this lockdown, or we didn't predicted the pandemic like in every places. So counseling line for women and boys, after internal meeting, we decided to provide our services online due to the lockdown situation. And at the beginning, it was a little bit not weird, but until now, until this situation happened, we have been used to work with perpetrator at prison probation office, also at our office, face to face and individual cases, and we were not used to work online counseling. So this has been a challenge not only for our client but also for the counselor by itself. So we decided, we get this decision between us at counseling line for men and boys, and we started to offer counseling line on counseling services online. At the beginning, the counselors were dedicated to work from their home because everything was locked and nobody was allowed to go outside. And step by step, when the Ministry of Health came out with some other protocols, we started step by step to continue online and office, to respected all the institution protocols and their advices. And during the first week of May, we started with the first cases online. I want to mention that we are working face-to-face, individual counseling, not with group. And step by step, we now are working online with a perpetrator that it's easier for them now to work, or they are living in different areas, south or east or north of Albania. So we are continuing in both levels. Counselor at Counseling Line for Men and Boys try to adapt and use as much as we can to develop Skype or to conduct counseling sessions through Skype, Zoom, Hangout, and with some of our client perpetrators that have age up to 55 years old. This was a little bit challenge and difficult, so we adapt our counseling session through phone calls. And also, these have been for our client at prisons because, as we all know, and as was mentioned during the panel discussion, that for a security reason, they are not allowed to use technology inside the prisons, but they can use the phones that are on corridors between cells in prison. I will explain a little bit more in slides above regarding this target group that we are working prison, because when the situation happened, we were not allowed or we could not reach our client perpetrator at prison areas. Cancel Line for Men and Boys staff used also social media and very famous TV program to inform the public and to talk about the importance of this service. What we have done else, perhaps not only adapting our service and doing online counseling, we were focused a lot on social media just to feed up all persons, mostly men and boys, and we have participated in very famous TV program in Albania when we strongly pointed out that victims of domestic violence or potential victims of domestic violence are in very dangerous nowadays because of this lockdown situation. But not only doing this awareness, but also we shared our contacts with large media, with a large audience, and also we invited them to call us and to ask help in at our services. But also we have prepared and distribute written materials related to self-management, and this has been very useful. We shared this online at our page on Facebook and website, but also during the TV programs, we have been careful to read or to explain different tech exercises that help on self-management. But also during this time, we try to adapt also our prevention program, because Counseling Line for Men and Boys is not only working with perpetrator or doing counseling and therapy, but we are working a lot with youth in high school. So we adapted also on online version, also the meeting and workshop that were planned. But what we have made different is that we try to adapt these workshops based on their needs, because many youth that we are working on prevention program, they are faced with the lockdown and they closed. They was not allowed to go to school, but for some of them, they were in the last class and they needed to go through these final exams that are very, very decisive if they will continue or if they will start the university or no. So also they have been very frustrated, and during this conversation and workshops, they pointed out that their behavior have been frustrated, and they noticed that they are very impulsive towards their parents, brother, sister, but also with their friends, or for some of them in their personal relationship. So we try to adapt our workshops that we had planned also in this open discussion and this focus group to talk regarding or overcoming the fear and anxiety that lockdown has caused, but also the reason that they are in front of the final exam that is very important. So I can say that they found very useful because they saved time, they had time to study, but also one per week they had this opportunity that one workshop or two workshops they can attend in online Zoom or Skype or Hangout. Uh, let me let me stay a little bit on what happened uh, with our program and how did we adapt it with perpetrators that were referred from institutions and self-referred. I would start with perpetrators referred from court. During this lockdown, the only institution that were opened in Albania was the court, and they gave a lot of attention to the protection orders. So, even why this was a very difficult situation, we continued to receive cases from court and new cases and the cases that were before this lockdown situation happened. And at the beginning, we agreed with them to, after we evaluate their situation, the level where when we get so far, because for some of them we're at the beginning of session, for some of them in the middle, some of them we were preparing to bring them to close the program and to put them on a program of follow-up. So based on this internal evaluation and discussion among counselors and the director, we agreed that with some of them we will work online through Skype, Zoom, and some of them we will work on phone calls. And during this time, we have been very careful to not be so strict on the program, but also to give them a area or space that they could express more what is wrong with them. Like, for example, the fear, the insecurity of what will happen. And we try to combine the techniques or the program that we have for perpetrator, but also on mindfulness and also with these exercises that can release or bring out the tension and this insecurity. So during this time, I can say that with perpetrator from court, we have been very careful, case by case, to adopt our program and to not go so straight to the program. Even why we suggested them that between the sessions, because the program is one session per week, they were allowed to call us and just to ask for information or if they want something new. And with some of them, we agreed that we can have 2 calls per week. So we have been very flexible to help them on this issue. What we face, and I will mention a little bit later, a little bit down when I pass with slides, we noticed that for some of them it has been difficult to do these online sessions because of confidentiality, and they have this shame because relatives or family member could hear them from the next room. And I felt, and some of them told me openly that, hey, Bledar, this is a little bit difficult for us to go deep on these topics because of this lockdown, we are all in home. So I have to be very careful and to what to share and what not. I wanted to pass now with perpetrator that we have in program that were referred from prison. When I say referred from prison, I don't mean that they are coming to our office, but we are going there. And in a moment that this lockdown situation happened, we were not allowed. But fortunately, because of our intensive work at prison, in every place when we do counseling, there are contacts of our office that is a fixed number and a telephone number. But with this target group, we faced the biggest challenge because we could not call them. They have to call us, and they don't have too much time to call persons, but very very strict. So the call that they can do is expensive, and they have to pay by themselves. And for many of them, it was very difficult. But we agreed, not with all of them, but with most of them, that they can call us in different times, and we reduced the sessions in 10 or 15 minutes. And we know that is a little bit weird or is not how we do the counseling sessions, but we thought that it's better to reduce than nothing. So this will help to release them from this insecurity, because something that happened was that a big number of prisoners were infected by COVID, and for them a lot of fear and insecurity was around, and their relatives were not allowed to go to visit them to prison. So this increased their frustration, and we heard that they started to have a very difficult situation in prison, also among prisoners. And we heard also for some of protests inside the prisons that were heard and brought in media. So I think that we have been successful with law cases that we gave them the opportunity, or we let a window open for them, that they can call us, they can ask for something, and we try to adapt. On the first days of this situation was very intensive, just for them to release and to maintain our professional relations that we have built with them, and but was not in the same intensity with the cases referred by court, because, as I told, there are a big number of prisoners, and they are not free to call in every moment. They have to be very strict, and it's expensive. Regarding the perpetrators referred from probation office, also the probation office in Tirana, some cases referred, they come physically to our office, but with mostly of the cases, we agree that 2 days per week, counselor from counseling for men and boys are going to their premises, and they gave us a space inside the institution, and the staff there are asking that for all men that are convicted through probation service for domestic violence, they ask them to come and to be there on Wednesday and sometimes Friday, depends how do we coordinate together. In this time also they try to not bring, and the staff reduced working from home, and we have worked with the cases that we started the work before, and we have some new cases, but it has its own challenges to have this relationship built in a very good way when you started from in the very beginning the conversation through phones. But until now, we have several cases from probation office, and what is new is that now that we are trying to offer more and more canceling on online version, now we can reach perpetrators that are living far from the center, and they have this difficulty to reach our office. So for them, we find out that it's easier and they save time. For example, if they do the canceling through Skype, Zoom from their home and through phone. So I think that we are going in a good way. And also from the court, I want to mention that the number of new cases from court is increased. And sometimes before this situation that we were not so used working online version. And sometimes from the court that are far from center, we were obligated to say that we apologize, but we could not reach to work with them because they are living in north or in the west. So now we are accepting the cases from court from different places of Albania, and we are working with them. Regarding self-referred cases, I can say that this time the number of self-referred cases has been increased much more than in like before. And I think that this has been because of their frustration situation, but also because of our appearance and our work that we have done through social media and TV programs. I want to mention something that for first time in Albania, now at Counseling for Men and Boys, there are two men, potential perpetrators. One of them lives in Germany and one of them lives in Italy. So we are working with them through counseling sessions, and we are helping them a lot. And for the first time, we have clients from this part. I want to stop a couple of minutes on obstacle and challenge. I mentioned some of them before, and I will leave floor for the discussion. The obstacles and challenges, the first is that for counselor was a new way of working, because so far we have been done only face-to-face counseling, and we needed to discuss with each other and to have to help and to support each other. And these have been the main challenge, because also they have to deal with their own fears or insecurity, and to adapt these services. It's new for them. Equipments and the access of some of perpetrator to technology. Also, we find out that for some of perpetrator, due to their knowledge on technology, age, and access to the internet, sometimes we find difficult to postpone sessions. But now I think that we are more used, and it came more fluently to us, this way of preparation and setting the times. Perpetrator for prison can use only phone calls with very limited time, and we can't call them. This was the biggest challenge because of the higher percentage of perpetrators that are taking service from Castle Life for Men and Boys are from prison. So that was the biggest challenge for us because we could not call them, and for them it's very expensive and it's very limited the time that they can call us. Uh, Sometimes it wasn't comfortable for perpetrator because all family members were home and they could hear the conversation. And this was also obstacle or challenge for them and for us because we have to attend their speed or their level, how deep they want it or how much they want it to work. We try to adapt with some of them that they can do the sessions outside by walking. We try to be adaptive as much as we can, but also we find that there was a challenge. Some of them felt judged by their relatives that they are taking part in counseling program. They told us that because when I say relatives in Albania is a kind of custom, maybe in other places is not. For example, in same area are living four brothers. They build each of them one home, so they have each family, but they are living in the same area. So they are all together. On this context, some of men who are attending our programs, they find they popped out that they feel judged by their brother, sister, or nephew because of taking part on this program. We have to work much more on the mentality here in Albania. What was the next challenge was that missing the physical contacts. We all know, most of us are professionals and we have many years working in this field, and we know that working online is not the same level of working face to face because we miss the contact, uh, but also having in mind the overload situation for counselors make work more difficult. So when I have the discussions with counselor at Counseling Line for Men and Boys, they popped out that they are facing difficulties because on understanding their client or how to better fit the techniques or how better to help them because of those three components: missing the physical contacts, problem with overload situation, and sometimes difficult or non-verbal language. Sometimes limited interaction or different exercise have been also some of the challenge. Also, counselors were going through their own fears and security about themselves and their family. This has been a challenge to our services, and I mentioned when I made the question because even why we are focused very much how we will how we will better do our work or improve. But sometimes we forget that also we are humans. Also, we go through our fears, insecurity for ourselves, for family members. So, counseling line for men and boys, thanks to the supervision and also to these conversation or meeting between the staff have been useful for them to bring out these fears and security about themselves, and that have been useful. Just 4 points regarding lesson learned and achievements. For first time, as I mentioned, we have men that are taking part to our program that are living in other places like Germany and Italy. Number of self-referred perpetrators has increased. And now we are working online on a regular basis with perpetrators referred by the court from other city of Albania. And I have here in mind the perpetrators that are living in North, in East, and other places. Now for us, we are more open to accept them being part of our program, which until now we could not work with them. Sometimes we refer them to our program that are leading for perpetrator in Albania, or sometimes we have to bring back the response that I apologize, but because of we are very far, we cannot come in your city to have this counseling program. But now we are working regular basis through online, and I think that we are going in a good way. Uh, what it's more is that we are thinking to develop more and more this online service for the perpetrator. Like online working, like we at the beginning start face to face, we were trained and we are thinking to prepare group sessions in prison. Now we are thinking also to develop much more and to have a specific program on working with perpetrator. So